Imagine that your district has a measles outbreak, but many people do not know the symptoms. Without a communication plan in place, some cases may be missed, limiting your program's ability to help detect and prevent the spread of disease. Clear and effective communication about surveillance is essential for providing information to and gathering information from the community. This is especially important during disease outbreaks and after adverse events following immunization or AEFIs. Outreach to affected communities helps to address public concerns, prevent rumors, and promote community involvement. Disease outbreaks and AEFIs happen suddenly. Having a general plan in advance allows you to respond quickly. When planning communication for surveillance, use the same process you would use to develop any communication plan. In this video, we will focus on some key strategies for planning communication for surveillance, particularly during disease outbreaks and AEFIs. These plans are typically developed with or by disease surveillance committees, including a communication expert. When planning communication for surveillance, it is essential to inform the community with clear and accurate information, mobilize the community to assist with surveillance, and report surveillance data to higher levels, facilities, and back to the community. First, inform the community. During an outbreak or adverse event, establish open and direct communication with the public right away. Involve the community in your response plan so they play an active role in detection, prevention, and treatment. Let us look at key information to share during an outbreak and during an AEFI. During an outbreak, describe the signs and symptoms to look for using the disease names commonly used by community members. Encourage community members to report similar cases to the nearest health facility. Highlight the severity of the outbreak. Include the number of sick children or adults and use maps to show areas affected. Communicate how to prevent children and adults from getting infected and how to manage those with the disease. Finally, if there are rumors or misconceptions about the disease, include clear facts to dispel them. What are key messages to communicate during an AEFI? During an AEFI, present accurate information on which adverse events have been detected and what actions are being taken to address it, such as further investigation. Reassure the community that updates will be shared. If the AEFI was a result of program error, explain what steps are being taken to prevent similar events in the future. Again, address any rumors or misconceptions about the cause of the adverse event. Finally, emphasize the continued importance of immunization within the community. Next, look for ways to mobilize communities around surveillance. Community members can support surveillance by detecting and reporting cases that may go undetected by health facilities. Encourage health facilities to identify volunteers who can help with surveillance. And establish a plan for how volunteers will collect and report data. Plan clear and effective trainings and materials on data collection, analysis, and reporting for community members assisting with surveillance. Finally, report surveillance data to higher administrative levels, health facilities, and communities. While all surveillance data should be included in your regular reporting to the central level, be sure to report outbreaks and serious AEFIs immediately. Regularly report district surveillance data back to health facilities through reports, newsletters, or supervisory visits, and emphasize the importance of their role in surveillance. Give feedback on gaps and actions to improve surveillance, such as accuracy and timeliness of reporting. Finally, regularly report disease prevalence, morbidity, mortality, and any updates on outbreaks or AFIs to the community. You can do this through community discussions, opinion leaders, and the media. Reinforce the support and contribution made by community members and describe the progress made. Now you know some key strategies to consider as you develop a communication plan for surveillance.